Good morning, good afternoon, good evening, depending on where in the world you are, and welcome to reInvent 2020. My name is Shez Partovi. I head up Healthcare, Life Science, and Genomics at AWS, and it's a pleasure to present to you today an executive outlook on healthcare and how we're helping organizations like yourself accelerate transformation. Before I start, AWS has been around for about 14 years. I just want to let you know that about half that time we've had a dedicated healthcare life science practice. And we've had the pleasure of recruiting individuals that have been at the bench, been at the bedside, physicians, nurses, biochemists, informaticists to come and work at AWS so that as you engage our healthcare life science practice, you won't have to explain your business to us. We have the pleasure of working with some industry giants, global companies across the world, as well as some young hot startups. And what we recognize, no matter what size of the organization, whether you're a customer or a partner, we actually recognize that somewhere within your mission and vision statement, you likely have a reference to a single word that you all share, and that's a reference to the word patient. We recognize you're working hard to elevate the human condition, to make a difference in the lives of people, and we're really thrilled to be supporting you on that journey. Now, as we listen to customers, and as AWS, we always start by listening to our customers, and we listen to see what it is they want us to help them solve. A few themes come together, and this has been the theme in 2020 as well. One of the first themes is organizations are asking us to help them derive insights from their data, and to not simply look at the data itself and what was happened in the past, but to be able to look into the future to predict things and derive insights. The second thing, which is no surprise to all of you, is that there's a desire for personalization of healthcare. Our best experience anywhere is what we expect everywhere. And so health systems are asking us, and insurance companies, and as well as any of our customers are asking, how can we help them personalize the consumer health journey? And as we dive into these topics with our customers, inevitably a common theme, a third theme comes out, which is, how can you help us move our data to the cloud so that we can then derive insights and then personalize the patient and the consumer or the member health journey? Because with those data locked up in silos, it's very difficult to derive insights or to do things that are transformative for the patient journey. So let's, of course, actually one other thing before we start, which is foundationally, what we also hear is, by the way, all of this should be, tell me and explain to me how you have a secure and compliant environment so that we can do all of this with security and compliance in mind. And actually, let's start there. Let's talk about security and compliance at first, because at AWS, security is actually job zero. Some of the most sensitive data in the world is hosted on AWS, and the same security that protects that sensitive data is available to all our customers. And when you look at compliance, well, we comply with regulatory requirements all over the world, whether in North America, whether in a global sense, whether in Asia Pacific, whether in Europe and Middle East. We focus on making sure the environment that you are going to use complies with the local regulatory requirements. So that is why, in some ways, global organizations like Cerner have moved their entire population health platform to AWS because of the security and compliance nature and the global nature of our services. Or a company like Philips has moved its Health Suite digital platform, which has about 20 petabytes of data, whether it's imaging, EHR, patient-reported device data. Again, a global company depending and relying on AWS's global security and compliance features. Or GE moving its entire Edison platform for its machine learning environment onto AWS. Again, because of that trust and reliance of what AWS delivers to a company like GE. So let's get that out. Having gotten that out of the way, the checkbox on security and compliance, let's turn our attention to those three themes I told you about, which is, the first thing let's start with is our customers asking us, can you help break down the silos and move data into AWS? And so we have a number of services that help with data movement into the cloud. These data pipelines are things like Firehose, Kinesis, DataSync, AppFlow, Secure FTP. These all allow discrete data to move into AWS so that you can do the downstream activities you want to do. Now, of course, in healthcare, most data is actually not discrete. Most of the data is in clinical notes or nursing notes, physician notes. And so we also have a service called Amazon Comprehend Medical, which helps you break down those notes into discrete knowledge graphs. And so that you can then build machine learning models. This is more than just keyword extraction. This is around understanding the relationship between the data. So if it's a medication, what's the dose? What's the route? Where's the frequency? And this idea of being able to build a knowledge graph is what Amazon Comprehend Medical allows you to do as you move your data into the cloud. And then, of course, customers say, hey, can you help us move this data now because we want to work with others into standard ontology? And Comprehend Medical allows you to move it to ICD-10 or XNorm. There are ways of moving it into SNOMED as well. And of course, our lens on data sharing is that you may want to be able to share data, but not the patient identifying data. Our customers said, look, if we're doing a research initiative, we may want to share the data, but not the elements that identify as a patient. And so Comprehend Medical also allows you to redact out the protected health information so that as you're sharing those notes, the patient identifiers are removed. And when we look at data, it's more than just textual. For example, voice is common in healthcare, voice files, and with transcription being common. And Amazon Transcribe Medical allows you to go from voice to narratives. And then, of course, you can sort of daisy chain that and go from narratives to Comprehend Medical to knowledge graph. And so we have services that help you apply that to voice as well. And really, we take a holistic view of data. It's whether it's information that's tied up in faxes and PDFs, whether it's information in images, we allow you to move all of that into the cloud so that you can derive insights. And sometimes customers will tell us it's not just our first-party data. Can you also help us move third-party data? And we have services like AWS Data Exchange, and we have a whole host of data that's hosted in our open data registries. There are some like 64 genomic data sets on the registry of open data on AWS. Another good example is the Nice Strides program. This is a program that's led by the National Institute of Health in collaboration with cloud service providers, including AWS. And the goal is to break down silos, to liquidate the data and to allow it to be generated, analyzed, shared for research. And in that particular environment, there are 40 petabytes of data that's shared amongst 130 NIH institutions, 90 research organizations, and almost 1,260 researchers. So these are examples of being able to move data into the cloud and services that help you do that. Now, looking at a real-life example of an organization, a partner, Cloudticity, that actually use these services to derive value for the customer that Cloudticity had. In this case, a large state agency. Cloudticity was able to use these services to actually bring data from 6 different health information exchanges in this particular state into one data lake within 11 days. And these services simplify the process of moving that data using HL7-based standard messaging. And of course, that was so that the state health agency could perform analytics and to know how to deploy the resources that were essential in managing the pandemic in that state. Another terrific example is from Anthem. Anthem, insurance companies, including Anthem, send and receive millions of claims from providers around the US. And a team of specialists have to sit and manually, in a time-consuming way, examine and extract important information. And Anthem used Amazon TextRack to help them automate this process and have seen 80 to 85% accuracy in automating this process so that it's no longer limited to manual and they can scale using machine learning, Amazon TextRack. So those are examples of bringing data into the cloud. And we already start to sneak peek at deriving insights from that with the example that I shared with Anthem, for example. But let's really double click on insights itself and how once you've liquidated data, brought it onto the cloud, how it can apply machine learning and derive even deeper insights. Let's start with the example from Cerner. Cerner and AWS worked together to stand up a cloud-based command center dashboard to help the mutual customers, the health providers, better track clinical resources such as bed utilization, ICU occupation, and basically gain insights from real-time data coming to these dashboards, and then to use predictive models that are based on AWS machine learning to know where they should apply staff and resources next. It's like having tomorrow's dashboard today. And this command center really centralized operations and provided additional awareness that helped trigger the teams, the clinical teams, to take immediate action where it was needed. It basically enabled collaborative decision-making in making sure the right patient gets the right caregiver at the right time, at the right place. So that's an example of applying analytics. Now, of course, textual-based analytics is not the only way you can perform machine learning and put insights and derive value on images as well. A great example is with the Munich Leukemia Lab, which is the largest reference laboratory for leukemia diagnostics in the world. And what they do is the data they bring onto AWS is a combination of pathology image data, as well as EHR data, as well as genomic data. And then what they do is, having brought that data, using some of those services we talked about earlier, then are able to build machine learning models that help diagnose leukemia much quicker and with greater efficacy and efficiency. Just for example, looking at their genomic pipelines, the Munich Leukemia Lab was able to use AWS's technology to reduce their gene data processing from 20 hours to 3 hours. So an example of deriving insights and using imaging, multimodal actually in this case, imaging combined with genomics as well as EHR. Another great imaging example actually is from a terrific company, Butterfly IQ. Now, Butterfly IQ is first-handly practically changing the entire medical imaging industry because they've created a device that is essentially handheld, as you can see in that picture, and attaches to a phone and is able to allow ultrasounds to be done in the field. This is essentially democratizing to be able to do medical imaging anywhere in the world with a handheld device. Now, the challenge there is that there's a certain amount of skill needed to perform imaging, ultrasound imaging. And so Butterfly has built their entire hardware platform on an AWS cloud infrastructure, which allows them to use analytics and to help the operator be able to take the right sort of images. So if you can imagine taking pictures of your heart, for example, is difficult. You need a lot of training. And if you democratize the device and is available everywhere, Butterfly uses AWS machine learning to help the operators to be able to capture more appropriate images, to interpret those images better, to be able to do consistent measurements, to provide augmented reality overlay so that the operator knows how to take the right images. So using insights and machine learning from AWS with data from Butterfly IQ, building these models that ultimately help the operator operate this device anywhere in the world. So these are some examples of both insights from textual data, insights related to imaging, genomics, as well as real-time in the field. Now let's turn our attention to the next area where we talked about how to actually, customers are asking us to personalize the consumer health journey. And let's talk about some examples there. Now, one of my favorite and terrific examples of really personalizing the patient health journey, or in this case, the member health journey, is with breastcancer.org. Breastcancer.org has a website, and individuals that have been diagnosed or those that are loved ones of them who want information can register on this site. And what breastcancer.org wanted to do was to be able to provide much more personalized content to individuals based on their own personal cancer journey. And so what they allow is for individuals in a private private part of the site where you register and create your own username, password, you're able to actually upload your pathology report. And what breastcancer.org does is use some of the technology I shared earlier, like Comprehend Medical, to actually read the report and to be able to extract meaning from that and understand your cancer diagnosis. Then what they do is use that information to provide very personalized content, whether it's content that's on the site, whether it's emails that come to you personally. So an individual that might have a path diagnosis with hormone-sensitive cancer might get different content than someone who's got hormone-resistant. And so this is a level of ultra-localization and ultra-personalization of content related to your own personal health journey. Now, another good example of this is with a company called CareMonitor. CareMonitor is an Australian health tech startup that's really transforming value-based care by delivering really innovative health management platform. Now, a key part of value-based care is convenient access to care, because as you improve convenient access, you can then improving access improves quality, reduces cost. And one of the key elements of that is telehealth. And so what Care Monitor does is that they've done is actually use Amazon Chime, which is our Amazon Chime SDK, which allows you to sort of have video, audio, a toolkit, and screen sharing as well, and actually embedded that directly within their healthcare population health platform, and able to deliver a telehealth experience that allows individuals to gain access to care wherever they are. And then, moreover, actually, their Care Monitor is now experimenting with Amazon Transcribe Medical, which I spoke of earlier, to actually reduce the friction and burden even further, and to actually transcribe the conversation that's happening with physician and the patient on the telehealth environment directly into narrative notes, to even make it easier for the clinician. Now, because this platform from Care Monitor is built on a scale-up platform from AWS, they position themselves in the heart of Australia's COVID-19 response. This startup was able to collaborate with Western Sydney Primary Healthcare Network, as well as the Western Sydney Local Health District, to set up the first ever citywide remote monitoring of patients that were diagnosed with COVID in order to help avoid overburdening and to bring relief to hospitals. They actually set up a citywide remote monitoring using the technology that I just shared. And because it was based on a cloud technology, they were able to scale up without really any difficulty whatsoever. And one can't talk about personalization of care without talking really around personalized medicine, personalized diagnosis and genomics as well. And Grail is a great example of a company that's advancing personalized diagnosis and personalized care, because what they're doing is really developing a blood test to detect cancers early when treatment can be most successful. Now, Grail is arguably running one of the largest clinical research programs ever published in genomic medicine, because, and AWS is delighted to be helping them ingest hundreds of thousands of records and genomic data sets, securely and reliably store them, and then choose from a wide variety of analytics and machine learning to help them develop their detection products and to demonstrate that clinical utility. They're able to, through a simple blood draw, detect up to 50 cancers with over 90% accuracy, with less than a 1% false positive rate. And so this is an example of that journey of transformation where organizations are using AWS to deliver personalized medicine, whether in the case of personalized content, all the way to personalized diagnosis and efficient early diagnosis. Now, so up to now, I've reviewed how customers have been using AWS building blocks to move data to the cloud, to derive insights, to personalize the patient health journey, the consumer member health journey. And one of the foundational things at AWS is we continue to listen to our customers to see how we could make things even better. We always say 90 to 95% of all our roadmap is based on what you tell us and what you think we should be building. And so in this instant, as we've been engaging customers and listening to how we can help them move data to the cloud, how we can help them derive insights in a secure manner, we heard that there's still room to do more undifferentiated heavy lifting, to be able to make things even easier. Customers told us, look, health data is complicated, it's inconsistent, it's unstructured, whether this data is from lab reports or from conversations that are recorded from insurance claims, from x-rays, from clinical notes, from doctor's notes, that this information is still complicated to process, to analyze, and to bring into an environment where it can be derived insights from. And so we were challenged with how can we make it even easier for our customers to do this? And so we're thrilled at this reInvent 2020 to be announcing and introducing Amazon Health Lake. Amazon Health Lake is a HIPAA-eligible service that enables healthcare providers, health insurance companies, pharmaceutical companies to store, to transform, to query, to analyze health data at petabyte scale. That's really the magic here, at an incredible scale, in a secure way to deliver, to be able to derive insights and meaning from data. Health Lake provides sort of key features and functionality, from initial import of data, to tagging it, to indexing it, to transforming it, to searching it, and finally analyzing the data so you can ask questions from the data and uncover insights. Starting with import, HealthLake quickly and easily imports the clinical notes, the lab reports, the insurance claims, whatever data you have, and it uses all in FHIR standard format to bring it in. You can then tag it and index the data and to store in a secure and compliant manner and auditable manner. So you can audit the use of the access, which is important, as you know. And healthcare really transforms on the fly the unstructured data using specialized machine learning models into structured formats so that you can do powerful querying of the data that lies underneath. And so that really is what empowers the last part, which is it allows HealthLake to use pre-built ML models, machine learning models, to work on top of this now structured data, to analyze it, to understand the relationships between the data, to identify trends, to make predictions, and ultimately deliver better care for patients. So delighted to introduce Amazon HealthLake. Now, let's explore some of those key benefits because let's double click on that. First, HealthLake transforms data seamlessly to automatically understand and extract meaning and from that medical information, from that raw data, from that disparate data, like the prescriptions, the procedures, the diagnoses, and it accelerates a process that otherwise traditionally would have been manual, costly, slow, error-prone. So that's your first benefit. Your second benefit is that HealthLake identifies trends and actually helps make predictions. Healthcare organizations can finally use their entire patient record data to unlock novel insights, not just parts that you load up for a particular ML model, but all of it. And this gives healthcare organizations new tools to improve care and to reduce cost. Now, third, HealthLake actually supports interoperability standards, like the Fast Healthcare Interoperability Resource, FHIR standard. Data comes in through FHIR, can go out through FHIR, and ensures that data is shared in a consistent, compatible format across multiple applications. Amazon HealthLake creates a complete view of each patient's medical history and structures it in FHIR-based data format. So it's not proprietary and makes it easy to exchange. Now, when importing data into HealthLake, what's effectively happening is Amazon HealthLake is creating a longitudinal patient record. Each one of those dots that you see on the screen represents a FHIR resource. And so whether it's encounter-based procedure, diagnosis, labs, tests, medications, these are all being laid down chronologically. And these medical events are all being put together in a linear fashion so that you can get a view of a disease progression, a patient's medical events, and to be able to make sense of this both at an individual level, but also at a population health level. And of course, Amazon HealthLake works with other AWS services like Quick Start. So you can easily search your data, query your data, and develop interactive dashboards, or with Amazon SageMaker to be able to build sophisticated machine learning models, again, not based on a segment of your data, but the totality of the longitudinal patient record and within the population that you might be including in a SageMaker model to build out a prediction model. And of course, as I mentioned, easily able to bring data in, importing it using FHIR-based, exporting it using FHIR-based, and to be able to share that securely with third-party applications to promote interoperability. And at the end of the day, you have a collection of data sources that can all bring data in via FHIR format. The data is stored in a FHIR-inspired model. It's not proprietary, and you can export data using FHIR. And so Amazon HealthLake actually has a tremendous ability to support all your interoperability efforts as well. So we are delighted to present at reInvent 2020 Amazon HealthLake, and we can't wait to see what amazing things you choose to do and how we can support you on your journey using Amazon HealthLake. Now, at reInvent 2020, there are a terrific set of other presentations on healthcare. I invite you to take a screenshot here, and please make sure you go ahead and listen and observe and look at the presentations as well. It's really been a pleasure presenting to you today. Thanks so much for joining me and listening to the presentation. And thank you for your time. I hope you have a great rest of your day, great rest of your event. Thanks so much. Bye now.